that refrain of safe and effective, it's my kind of belief looking back and now is that was a predetermined conclusion. There was no data to support that, yes. But it was agreed upon that it would be presented as safe and effective. And for those of us who were a little bit more skeptical, more data driven, we saw that it was based on really no data, and the data started going sideways south. But the refrain got louder and more pervasive, and then they doubled down. They started to demonize the unvaccinated.
Well, that's a criminal act you're describing. So, I mean, I could ask you so many different questions about why the people who made that claim and abetted the killing of all these Americans aren't being held to criminal liability for that. But neither of us is a lawyer.
I want to tell you another deception. The entire country medical system calls the chronic problems after COVID, they call it long COVID, right? You've heard of the term,
yes.
Disease long COVID. So I'm an expert at it. But the reality is, if you look at my practice, maybe 1,200 patients, 70% are long vax, not long COVID, meaning all of their issues, the syndromes started after the vaccine, not COVID. The vast majority are long vax. And so the only disease that's recognized in this country is long COVID. All the academic medical centers, they have these little long COVID clinics. It's not vaccine injury clinics, it's long COVID clinics. So there's this constant burying of the role of the vaccine in what's befallen society.
Well, why? I mean, that's so evil that it's hard to believe it's happening.
It threatens so much. It not only threatens the reputation, credibility of our health agencies, which is already, I think, splintered and fragmented.
Yes,
I mean,
forever.
A week ago, a paper was published in Journal of American Medical Association. I just saw it this morning, where they actually surveyed people's attitudes towards the agencies and the vaccines. And a majority, about half to 60%, all have concerns over whether these things are safe. Now, I don't think that was going to be the answer 2 years ago, but a good portion of society now is now questioning not only whether the agencies are telling the truth when they make these proclamations, but you can see it in their hesitancy to get the boosters. I mean, those numbers are plummeting. So I do think that people are slowly becoming aware. But for those of us who've been aware for a long time and have been trying to fight to get people informed, it's been a war. It's been a long couple of years.
If the evidence presented you suggested strongly that the compound you're suggesting or requiring is killing people, you would think your own conscience would restrain you. I can't push this shit. People are dying. Like, doesn't anyone think that?
I don't want to make excuses for people's behavior, but I will be generous and say I think many of them trafficked in a toxic medical intervention. I think many can claim ignorance because I think most physicians are victims of the lies propagated in the high-impact journals. That is a whole issue. What's happened to the high-impact medical journals over the last several decades, how they've been completely captured and run by the pharmaceutical industry, means that the pharmaceutical industry can get doctors to believe whatever they want. And
by publishing in a small number of journals.
Absolutely. Because I usually say the big five. You know, it's New England Journal of Medicine, Journal of the American Medical Association, The Lancet, the BMJ, and Annals of Internal Medicine. But there's a few others. But when you get a paper in there, I mean, that's like, you know, planting a stake in the ground of truth, right? And so if you get a review paper saying that something's safe and effective, those doctors are now responsible to inform you because this is the heights of science. This is the best journals done by the best. This is the impression they have. And I got to tell you, Tucker, this is what I believed before COVID. I literally idolized, deified those journals. I really thought the best science and scientists were published there. And there was really simple stuff that we knew that would help fortify immune systems and help protect against severe disease that we thought that are super safe, that on a risk-benefit precautionary principle, we should have, as a rule, just recommended. Vitamin D for one. We should add a vitamin D, supplementation campaign nationwide. Would have been very easy to do. Now, as an aside, vitamin D has been one of the most attacked substances over the last 3 or 4 decades by the pharmaceutical industry.
Why?
It threatens the disease model. I mean, we can do an hour on vitamin D, Tucker, but
vitamin D like in milk?
Yes, like vitamin D. Like vitamin D is a whole other discussion, but they're terrified of vitamin D. Our normal reference.
Can I say, if you find yourself terrified of vitamins, you're probably on the wrong side.
Exactly. You're probably on the wrong side.